So as Ben mentioned, we wanted to talk a little bit more, expanding on what Imran had been talking about, on where we've really gone with this. We'll talk a little bit about the app itself. We'll talk more about the interaction of the different parties and where each one of the folks draws value. And one thing I want to mention before we even really get into it is a good part of what we identified even very early on when Pfizer and Biogen, we and Almec and others were sitting around the table, was it became very clear that everyone needed to be treated as a peer in this environment. And the advantage of treating everyone as a peer was there's a lot more interaction between them. Everybody has the opportunity to contribute, everybody can draw information out of the system, and everyone can get a unique view that's specific to their role in that system. As we go through this, I'll talk a lot more about that, but that was one of the unique advantages that blockchain brought to the solution. So as I go through this, you may never hear me say blockchain again. And the reason for that is it's almost a bit of a distraction. It's a capability that we're able to bring forward, but in the end, it's not about the technology, it's about the peering capability, it's about the unique ability of each individual to see what they need to see. It's not about the technology itself. It is only because it's unique that brought us to this point. But the truth is, there are a couple of other ways that we could have done this. Blockchain just was the most effective way to bring us forward. So you've seen this a little bit before, but I'm going to come back to some of the basic capabilities. First and foremost, product tracking. Everything that we were focused around early on was about track and trace. There are other value propositions that we'll talk about in a few minutes, but it's where all of the most important information comes from. As we start to get an understanding of, okay, so product tracking is where we get the majority of the information that we'll share, and it's also one of the primary functions of the application. But in truth, the fact that we have real-time product data is what allows us to get other folks to participate as a part of this. Immutable records are an important part of it as well. We have very strong belief and knowledge of where things are at any given point in time. It can't be changed. Again, a part of the advantage of the technologies that we've used. So it can be trusted. In some cases, it's directly integrated with other systems, IRT and so on. In some cases, it's directly connected to a user. Through the app, through a website, whatever it may be, we have a number of different phases in which that can be presented. The focus early on had been around reducing site burden and increasing value of information. That's really where we were most focused. We'll talk about a lot of different use cases associated with it. We'll talk about different sources of value. But when you come down to it, it's those two things. One, the reduced site burden, and two, a focus on better quality information presented. And again, the collaborative model, this idea of peering between partners. And Mike, please add anything you like.
The next slide we should talk.
So we talked about typical integration points, and we talked about the fact that sometimes this will be directly connected to a user, but sometimes it'll be to a system. One of the early bits of feedback we got from Almec, for instance, was they never wanted to see an app, ever. Everything needed to be integrated into their existing systems, which is, from our perspective, better as well, because we get true information as soon as it's available. And we give them true information as soon as it's available. One of the things that we've seen in the past is there's a lag of information for a number of different things. As an example, today when sites are required to use IRT systems, generally those sites are training an individual, maybe two, in those systems. And they're actually logging into those systems maybe once a day, maybe every couple of days. When we have these real-time connections, as they scan a product in at the loading dock, we immediately get that information. So all this moves much more quickly. And just as importantly, we feed that back to the IRT as soon as we receive it. Same is true for ERP systems, same is true for logistics and site inventory systems. If a site decides they want to build a real-time integration with us, we can. Otherwise, we're actually giving them a fairly light site inventory. So either way, they're getting some value out of that system. And I won't go into all of the rest of the other integration points, but we have a lot that we can do, but absolutely zero we have to do. In these early pilots, as an example, Savota will be doing one of the early pilots that we're doing with Biogen, they'll have two screens, one for their IRT system, one for KitChain, and they'll enter information in both places. As we mature, that'll become an automated interface. But this is what allows us to move through the pilots relatively quickly without having a lot of technology debt that we build into it.
Why don't we go to the next slide, Greg, and just talk a little bit about the value proposition, the business value, the technology value, and the financial value. And I think what we really saw during the KitChain demo and use with Biogen, and I was at the Miami site, Ben was at the Anaheim site, and when we first did this receipt, we were actually just manually coding it into our iPhone and into the application. It took us about 30 minutes to receive all of the product. We then used the barcodes and scanned it, and it took us about 3 minutes or less to do the scan of the materials into the system. And so, if you think about site burden and from receipt to reporting to auditing, the goal here is to reduce the amount of time that the pharmacist has to spend receiving the inventory. There's value in the technology that's being used, but from a financial perspective, all of the parties are getting the same information in a real-time fashion so that they understand inventory movements, when you're doing reconciliations, when you're taking the dispensing the product, we can flag it as well in the application. And so just trying to ease the burden of the site, particularly, and Ben, maybe you want to speak just briefly to the study at the UCLA and the experience there in terms of the number of sites and the number of products that were going through the demo at that time.
Yeah, we've done a lot of work with UCLA Health Pharmacy, and on their investigational side, there are over 700 clinical studies that they're trying to run that typically they're shut down completely to new studies. And so again, the goal that we raised was to try to get everybody on the same portal over time, gradually move people to the folks where they're getting an advance ship notification the day in advance of every new shipment, and then getting people to the point where they can really get it into the refrigerator and limit the damage from the get-go.
Yeah. I think it's important to say, too, we'll talk and we'll continue to talk about the value that this is presenting to each of the parties that's interacting with the system, whether it be the sponsor, CMO, CRO, sites. The patient figures into this as well. In one case, one use case we'll talk about where it's direct-to-patient shipment, there's a version of the app that'll be made available to the patient to log that they've received it. And in good condition, do they need to return and so on. But the real important aspect of this to the patient is something that they'll never see. There will always be a product available for them when they come into a site. It's one of the things UCLA was most focused on. Is the product available? Is it within expiry? Are we going to schedule a patient? They have the ability to check and see the exact status of the exact dose that they'll be giving to a patient prior to the patient coming in. And it's one of the things they use most often. Ben can tell you, in one particular example, they were checking up to 40 to 50 times the status of a product before they dispensed it.
Yeah, I think that's right. I think we saw them peak at 99 times. The UCLA staff were checking on an individual item. But again, what you're talking about is a patient that is at risk of death if they don't get the right item. They're coming in. It's a massive infusion process in the back of their neck. And so they want to make sure they get it right and everything's lined up.
We'll go to the next slide, Greg. Some of the other value segments that we've been looking at, right? The administration component of site-to-site shipments. So sponsors have better insight into shipping inventories. If we had to move product from one clinical study site to another, we have the ability to do that, and with the ability to track the data involved in that and reducing the product waste, loss, and overstock. If you think about how do you close out that study, the sites are unable to associate study lock with a study until it's too late for return, for inventories and audits. The application allows you to quickly close out the inventory. We're working on destruction notifications for the next pilot. We're also working on a number of other components to make sure that the site has as minimal burden as possible related to the use of the application.
Yep.
So
this last slide, and this is our last slide. At the beginning of the pilot, we did the data science behind the entire product. All of KitChain was designed to have certain capabilities. We sat down with the team, and again, this was Pfizer and Biogen and GSK, Merck. BMS was still present at that time, and there were a number of others, plus Allmec and us and a few others. And one of the things that we started to focus on was, okay, we've built all of this data science around the problem. What do we have the capability to solve now based off of the data that we have available, the flows that we've built so far, and this was the answer. A great deal around logistics. Inventory tracking, we measured separately from logistics for a few reasons, not the least of which is different audience. Clinical site operations, whether it be dispensing or accountability or trial closeout, which we started to talk about just a few moments ago. A lot around quality. Mike happens to be one of our quality guys, so we can talk about that in great depth if we choose to. Import-export capabilities. This was actually one of the first things that we built as a capability, because one of the sponsors that was involved really wanted to focus around how they could improve their logistics around intercompany shipments, how they could better understand what was going on, and how they could better negotiate contracts with shippers and logistics partners and so on. There's a fair amount of regulatory capability here that we didn't think about originally, but we realized we had all the data we needed for around recall and authenticity, and authenticity has become rather an important aspect of the commercial side of what KitChain can do. And auditing. Because we're a real-time record, auditing becomes much easier to do. Patient compliance, because we have this direct-to-patient capability, we also have a better understanding of patient status. We can gather e-consent. We generally don't expect to because there are other capabilities that do that better. But for a small study, for a small vendor, it may be something that becomes important. We have the opportunity to gather SAEs because we're already gathering information from the patient when they get a direct-to-patient shipment. We have the capability to gather some basic information from them as well and kick off that process. We don't expect to close it out, but we know what to do when we receive that information. And some basic site things around future notification across sponsors. This can be used by more than one sponsor at a time. That was the basic design of it. Around inventory, we talked about basic inventory that can be provided. And the trial closeout one became very interesting because one of the reasons that, and I'll speak specifically to UCLA, one of the reasons that UCLA felt that they had so much inventory in their research pharmacies was because of all the stuff they couldn't return, that they were legally bound to keep, even expired product that they couldn't destroy. And local regulations in California that prevented a lot of the destruction that they needed to do. So suddenly they were in a position where the earlier we know about closeout and the inventory that goes along with that, the more likely we are to get a sponsor to take it back. And we built some processes in to help with that. So all of these became capable. Not all of these have been built, but the data science behind these is done, and that allows us to build them quickly. And at no point are we going to be in a position to say, no, we can't do that because of the following things. We know we can do these. There are probably others we haven't considered, but these we have the data to support. So I think that brings us to questions. But we have a little bit of spare time. Please.
Hopefully it's not an inappropriate question. Phil Heifetz, I'm with Innovative Supply Solutions.
Sure.
Is there a business model attached to this?
There is.
Okay, and how would that work?
For the most part, the sponsors are driving this. We do offer it out as a capability out of IQVIA as well, though we don't expect that to be the primary way in which it gets sold. Primarily, we expect the sponsors are going to be interested, largely right now around the ability to reduce burden at the sites, but also the ability to better control complex studies. We have one that we're considering for this right now, where supplies are coming from 7 different sources into one site. Rather than shipping them through warehouse, we'll use this to do the controls around that. So this becomes a possibility. But the commercial model largely is sponsors paying for it. There's generally, and Ben can probably speak to this better than I can, but the general focus is a per trial fee associated with number of patients and number of sites, and a setup fee that goes along with that. Because the truth is, most of the expenses associated with it are really around setup and shutdown. And the transactions in between are, there's a cost associated with it, but they're less burdensome. Am I making sense to you?
Yeah, is there a problem if you have a depot, you have somebody who is in supply chain and doesn't participate?
That doesn't participate. Yeah, it would.
You're collecting all the data at the site, or you're collecting it throughout the whole?
We're collecting it throughout the supply chain. In fact, that's really the point. What we are interested in is from point A, wherever that may be. It could be at the manufacturing location, or it could be at a depot. But from that point forward in the supply chain, we're tracking.
We have time for quite a few questions, so we'll go ahead and continue.
Yeah, just adding to Greg's point, I think that one of the benefits that sponsors are looking for is reduced comparator cost. And so when they've got a study with a very high comparator cost and you're seeing some monster, bills in these phase 3s, the idea if they can cut back just, one inventory turn, that would be a big, big savings. Then the related question, obviously there's going to be stakeholders that are not technologically sophisticated and are averse to BYOD kind of issues. And so the goal in those cases is to provide an email fallback as often as possible so that, everybody pretty much has access to email. And the idea is that they can email out of a phone, even if it's a BYOD averse place or they've got their desktop. The challenge is less where folks are using machine to machine and desktop, but where they're going to need to scan something. But again, which is what Mike Keech was talking about, the fallback there is to do a manual entry. That's not the desired thing, but when you prompt for a study, you only have to enter a couple of digits to sort of cover it if it's already set up to ingest that particular study. Yeah, exactly.
Yeah.